All right, sleep. We all need it to function, but there are a lot of people who aren't sleeping well or waking up after a full night's sleep still feeling exhausted.
And sometimes it can be serious enough for medical intervention. Melissa Cole visited Starling Physicians in Manchester to learn when it's time to see a doctor.
Something worrisome happened to Dwight Dagenhart of Old Saybrook while giving a presentation.
What happened was, here I'm standing in front of 10 people, and all of a sudden I fall asleep while I'm standing there giving a presentation. So it was, yeah, kind of shocking.
And then this.
I used to fall asleep while I was driving. I was coming through New York to come back to Connecticut, and here I am, you know, I'm coming across the Tappan Zee Bridge, and I'm just like, whoa, all over the place, and all of a sudden I snapped out of it, and I realized I got off the tap and I took a nap as best I could.
Dwight reported these incidents to his doctor, and the diagnosis? Sleep apnea.
What exactly is sleep apnea?
So it's a condition where the throat muscles get a little bit too relaxed, and in that process the airway starts to close off, and then they can't breathe well. It's something that could develop with age. As people become older, their muscle tone gets a little bit more relaxed. More often it's due to weight, and people gain more weight around their necks.
Dr. Jeffrey Nascimento of Starling Physicians says feeling fatigued upon waking after a full night's sleep is one of the telltale signs.
They feel tired all the time. They just figure it's part of life. They work hard, and so they must be just tired from that. But more often it's because spouses or bed partners will say, you know, you're snoring, you're stopping breathing. I think you need to go get this checked out.
Exhaustion was what brought Hannah Gebhardt of Rocky Hill to Dr. Nascimento.
I was just not sleeping well at all. I was waking up at my usual time and feeling like I hadn't just been sleeping for 8 hours. Very tired, not being able to focus well.
Hannah also got the sleep apnea diagnosis, and there are 2 ways to reach this conclusion. You can stay overnight at a sleep lab where your sleeping is monitored all night long, or conducted at home with the proper doctor-administered equipment.
That's a newer thing that's developed maybe over the past 5 years or so, where insurance companies are recommending doing that first.
Within a week or 2, results come back and they look like this.
When you see stuff like this where it goes flat, then it actually means that there's not any airflow at all. Wow. And so the person is trying to breathe, but they can't because there's no airflow there and there's a drop in the oxygen. So that would be an apnea.
This patient has a significant case where 60 times an hour his breathing was abnormal.
So that's basically once a minute where his breathing is off. Wow. And so that's, you know, that's a lot.
The treatment for sleep apnea is this.
So this is one of the typical CPAP devices. You can see it's pretty small. It has like a little water chamber here for humidification that makes it more comfortable for the patient. And basically off of this device comes a little hose that then connects to one of these masks.
The masks have come a long way over the years in terms of size and comfort. This is a full face mask that covers the nose and the mouth. This is a smaller version that just covers the nose.
So this is just the nasal pillows, so it kind of looks like the nasal mask, but it's just a little bit different.
I've been using the CPAP for about 4 months now. Works super well. I was concerned that I wasn't going to be able to take to it immediately because they always warn you it's going to take about a month or so to get used to it, but I was pretty much able to sleep with it right away.
Dr. Nascimento can download patients' reports from their CPAP machines so he can see how they're breathing and sleeping. This is Hannah's.
On her data, she's using the machine about 9 hours a night. When you look at, this is like a month, over a month's period, every line indicates that she's using it every night.
I feel well rested every time I wake up, and it was like, oh, this is the first time I've ever feel well rested in my whole life.
Really?
Yeah, it was crazy.
Dwight is also having amazing results.
And how are you sleeping?
Oh, I sleep great. I sleep great. I like to say it's the single best medical procedure I ever had that I had such an immediate response as far as helping me. Because that first night that I actually had the CPAP, it was like I hadn't slept forever, and all of a sudden I woke up, I was so rested.
If we think about it, we spend about a third of our day sleeping. And so it's an important part of what we do. We don't really know why we do it, but something about sleep makes our body function better.
I think I might be making a phone call. If you or someone you love is having sleep issues, the medical staff at Starling can help. Head to starlingphysicians.com to find a specialist near you.
How great is that now that you can do it home as the first line of defense? A lot of people don't want to sleep in a clinic, so you can try it maybe at home first. Better Connecticut continues right after the break. See you then.